Hi everyone. Today we'll be going over healthcare and medical insurance coverage in the United States, specifically regarding those Ukrainians who came from Ukraine with Ukrainian humanitarian parole status. All right. So, medical services are very expensive in the US, and if you do not have health insurance, you will need to pay for every medical service out of pocket. Medical services include doctor's visits, outpatient hospitalizations, inpatient hospitalizations, medical transportation, checkups, tests, blood works, medicine, vaccinations, specialist visits, dental services, ophthalmologist, and more. But even if you do not have medical coverage, you may still be receiving medical care. So, what is the importance of health insurance? It is very important in the US to have medical coverage. This way, you will not need to pay out of pocket or pay very little, but it all depends on your healthcare plan and coverage. Some doctors do not take patients without medical insurance. If you arrived to the United States with Ukrainian humanitarian parole status before October 1st, 2023, most likely you will qualify for free Medicaid if your income is not high. If you arrived after October 1st or your income is higher than poverty level, you can apply for medical coverage through the Penny Market website or through a local free agent. So, there are a few options on getting medical coverage in the United States. One of them is if you have a low income, you can apply for free medical coverage through your local county assistance office. Second option is you can receive medical coverage through your employer, but not every employer offers benefits and healthcare coverages. And the third one, you can obtain medical coverage through Penny Market. There are brokers that offer free services. Okay. If you just arrived to the United States through the U4U program or through the southern border with the status of humanitarian parole and have no income or low income, you can apply for Medicaid through the Compass account. You can also visit your local county assistance office and apply right on the spot. But make sure you request an interpreter when you have an interview with your county worker. Please do not forget to renew your benefits because if you do not do it on time, you may lose your benefits and will have a gap in coverage. It can create a bit of extra stress for you and your family. You can also apply for other benefits while applying for Medicaid. Of course, income level is your main indicator, but if you qualify, you can add other benefits to your application, such as SNAP, cash assistance, CAP, LIHEAP, home care services, and more. Medicaid covers most of the medical services like doctor's visits, specialist visits, prescription medicine, medical supply, lab works, tests like CT, MRI, X-ray, ultrasound, and more, preventative care, annual checkups, maternity care, newborn care, rehab services, long-term care, outpatient services, and inpatient services. Many surgeries are done through outpatient services. Most of the time, patients that are going home after surgery, which are done within a few hours, if there are no complications. If patient needs to stay overnight, we call that inpatient services. So these are some of the income limits graph you can look over. Okay. Please create your Compass account. Follow the instructions very carefully. Any mistakes can disqualify you from the benefits. So, how to apply for Medicaid and other benefits through Compass account? Before you start, please prepare all the necessary documents such as passports, I-94, your work authorization, social security number if you have one, income, and proof of address. You may also apply without work authorization and social security number if you do not have one already. First, you need to create a username and password and answer the security questions. Please make sure you write them down and keep the answers in a safe place. Then you will need to enter your personal information, your household information, your immigration status, income, and expenses. If you already applied for benefits and never created a Compass account, you can create one at any time. It is very convenient to have one. You can upload any documents, report changes, complete renewals, and check your benefits. In order to create a Compass account with your existing benefits, you will need any letter from your county assistance office with your case record and UFI number. In the end of the application, you will need to choose if you want to be received online messages, text messages, or by mail. You will need to agree for terms. After your application was submitted, you will receive a list of documents that a county assistance office is requesting from you. You will need to submit copies of your documents. Please do it as soon as possible. Sometimes you will need to send the documents a few times. Please be patient with this process. You will need the following documents for the application. First is your passport, but it is okay if your passport is expired. Your I-94. If you do not have a copy of your I-94 form, you can get an electronic copy from a website. You can just search up i94.com and you should be able to retrieve your document. The third is your stamp and passport. Fourth is your work authorization if you have one. Fifth is your social security number if you have one. Sixth is your means of income. Seven are your expenses, which include utilities and rent. And eight are medical bills if you have one. Some clients have difficulties with confirming their income. So one would be no income. If you do not work and have no income, you may simply write a letter that you do not have any income and explain how you cover your expenses, if you have any. You may also inform your caseworker that you do not pay for your shelter and more. Number two, if you work and receive a paycheck every week for every 2 weeks in a form of W-2, then you will need to submit your income for the last 30 days. And number three is a lot of Ukrainians are self-employed and do not have pay stubs or checks every week or two. Sometimes they have seasonal jobs or have unstable income. It can be very difficult to submit proof of your income. In those situations, if you have your income tax returns, you can submit Form 1040, or another option is to request a profit and loss form from your accountant. Okay, so you will need to renew your Medicaid every year. Please do not miss your renewal period. It is very important for you and your family to have medical coverage. If your income is too high to qualify for Medicaid and you have children under the ages of 19, your application will be sent to another program called CHIP. CHIP also offers very good coverage for children. It could either be free or you may have to pay a small fee. It will really depend on your income. Alright, so how do you choose an insurance plan and a doctor? After Medicaid application has been approved, you will need to choose a plan and a doctor. The most popular plans in our area are Health Partners and Keystone First. However, any of the four plans cover nearly the same, but not all doctors accept every plan. You can visit this website and choose your insurance plan and your doctor. You can renew your benefits online through your Compass account. You will see the option to renew benefits. Please follow the instructions and feel free to contact your case manager if you have any questions. When you are approved for Medicaid, you will get a temporary insurance card. We call it an access card. If you receive SNAP benefits, then your EBT card may serve as an access card for medical coverages temporarily. Other family members will receive white plain access cards as well. Please have both cards with you at all times. You never know when you might need them. If you have a Ukrainian humanitarian parole status, you qualify for all the benefits and ORR services. You can renew your parole status for another 2 years. If for some reason you decided to apply for TPS and not to renew your Ukrainian humanitarian parole status, it will disqualify you for the public benefits. If you arrived to the U.S. with Ukrainian humanitarian parole status on or after October 1st, 2023, unfortunately, due to the conflict in the U.S. Congress, you do not qualify for public benefits. But we encourage you to apply for Medicaid or emergency medical coverage if you have small children or have serious medical issues. In the case you are denied Medicaid, you can apply for private medical insurance through Penny Market. And since your income is low or you have no income, you may be paying very little for the insurance. But you will have a peace of mind in case you need to go to the doctor or a hospital. Some employers offer benefits and specifically medical health care coverage through the company. Usually, if they offer medical coverage, they might have few options, so please make sure you understand what you are signing up for. Ask questions, check if your doctor accepts this insurance, and more. The employer subsidizes the cost of the health insurance premium, but you will likely still need to pay something for the premium. Penny also offers hundreds of different plans and options. It is not easy to understand the system even if you speak English very well. We recommend to find a broker or agent who provides free services and speaks your language. Penny can be a very good option for you if your income is low, but you do not qualify for Medicaid. Your monthly payment will be low. The higher your income, the higher your monthly payment. If your health is good and usually you do not need to see doctors often, then you can get a less expensive plan with higher deductible. But if you need to see doctors often, then you will probably need more expensive plan with a lower deductible. Feel free to ask your agent as many questions as necessary to understand the plan. Penny is not open for enrollment all the time. They have a specific period open for enrollment and it is usually from November 15th through December 31st. But they do have few exceptions. If you just arrived to the country and you are a new immigrant, you were disqualified from your current medical coverage, or you applied for Medicaid but you were denied. Please, before purchasing medical insurance from Penny Market, consult with an agent or broker. It is very crucial to understand the services and the policy. Ask your family or friends to recommend a good specialist, someone you can trust. So this again, the enrollment periods which are open through November through January. If you do not have medical coverage but have a medical emergency, please go to the nearest ER. Your life and health are precious and you need to take care of yourself. Every hospital has a social worker and they can help you apply for emergency medical coverage. Also, every hospital has a charity fund and they can help you with getting financial help in a case of financial difficulties. The medical billing department can help with splitting the payments and creating a payment plan. Please, do not hesitate to look for medical help in a case of medical emergency. So what is a medical emergency? It can be an injury or an acute illness and poses an immediate risk to your health and life. It is very important to seek medical help, go to the ER or call 911. Please do not hesitate with this if you have an urgent medical need. Emergency medical assistance is open to non-citizens and newcomers, immigrants, and temporary residents with low income. You have to have a medical/health emergency to qualify. Ukrainians with TPS status may qualify for emergency medical assistance. If you have a emergency medical condition, you may be eligible for emergency medical assistance, even if you are not eligible for Medicaid due to your immigration status. You can apply for this on Compass, just like regular Medicaid, but you need to provide proof of your emergency medical condition. Pennsylvania Health Access Network, which is also known as the PHAN helpline for help with understanding this process. Please call the number listed below if you need further assistance. If you have a medical emergency and you do not qualify for Medicaid because of your immigration status, you may qualify for emergency medical assistance. In order to qualify, you have to have a medical emergency and low income. Okay, so CHIP is a state medical coverage for children ages from 0 to 19. If your income is higher than the minimal amount and you no longer qualify for Medicaid assistance, but you do have children under the ages of 19, they may qualify for another state program specifically created for children under the ages of 19. This program is very similar to Medicaid. There are a few payment options in the case you do not qualify for free CHIP program. Please check the income limit form. You can apply for CHIP through Compass account even if you apply for Medicaid, but you do not qualify because of income. Your application will be redirected to CHIP program automatically. So you can look over the CHIP income guideline chart to see if you qualify. So just as we previously spoke before, the health insurance program specifically dedicated for children from the ages of 0 to 19 is called CHIP. And these are all the coverages and information that you would need. Please feel free to look over the slide. Children vaccines. Please follow the vaccine schedule and discuss any questions with your child's pediatrician. There are two types of medications in the United States: OTC, which are over the counter medication, and medication that you can get only by prescription. OTC would include cold and flu medications, pain relievers, cough medicine, nasal drops, vitamins, first aid medicine and supply, allergy medicine, and more. Prescription medicine is the medicine that is available by prescription from the doctor. Usually it would be antibiotics, stronger pain medicine, and a lot more. You can get medicine from pharmacies like CVS, Rite Aid, Walgreens, Walmart, Target, and many small local pharmacies. In Philadelphia, we have many small pharmacies with Ukrainian/Russian speaking workers. Please, when you get either OTC medicine or prescription medicine, consult with your pharmacist. It is very important to know how to take medicine and their possible side effects. So, what is the difference between urgent clinic and ER? Urgent clinics are many clinics that you can provide medical care if you have minor sickness and injuries like cuts, cough, fever, UTIs, and more. Urgent clinics are not open 24/7. They're usually open from 8 a.m. to 8 p.m. or some until 10 p.m. They may have limited working hours on weekends. Some of them, like Patient First Urgent Care, may provide you even with medications. If you have more serious health issues like chest pain, broken bones, or injuries, and other life threatening conditions, you might need to go to the ER. Every hospital has an ER department and they are open 24/7. You can always call your family doctor first and consult with them if they are available. So, types of health services in the United States. The first one would be primary care, provided by healthcare professionals such as family physicians, internists, pediatricians, and nurse practitioners. Primary care involves general medical care, preventative services, health education, and coordination of care. The second one is specialty care. Specialty care involves services provided by healthcare professionals who have advanced training and expertise in specific areas of medicine, such as cardiology, oncology, neurology, orthopedics, psychiatry, and obstetrics, gynecology. Third types are emergency care. Emergency care services are provided in urgent situations when immediate medical attention is needed, such as accidents, sudden illness, or severe injuries. Emergency departments in hospitals or urgent care centers typically offer these services. Four would be mental health services. Mental health services include assessment, diagnosis, treatment, and support for mental health conditions such as depression, anxiety, bipolar disorder, schizophrenia, and substance abuse disorder. Services may be provided by psychiatrists, psychologists, social workers, counselors, and other mental health professionals. The fifth one is preventative care. Preventative care services aim to prevent illness, detect health problems early, and promote overall health and wellness. This may include vaccinations, screenings for various diseases, for example, cancer screenings, cholesterol screenings, counseling on healthy lifestyle behaviors, and education on disease prevention. The sixth is rehabilitation services. Rehabilitation services help individuals recover and regain function after injury, illness, or surgery. This may include physical therapy, occupational therapy, speech therapy, and other forms of rehabilitative care. Seventh is home healthcare. Home healthcare services are provided in the home setting for individuals who are recovering from illness or surgery, managing chronic conditions, or needing assistance with activities of daily living. Services may include nursing care, assistance with medication management, physical assistance, and medical equipment provision. And the eighth is palliative care and hospice care. Palliative care focuses on improving the quality of life for individuals with serious illness by addressing pain, symptoms, and emotional and spiritual needs. Hospice care provides supportive care for individuals who are nearing the end of life, with a focus on comfort and dignity. All right. So, from everyone from our team, we would like to say stay healthy, take care of yourself and your loved ones. And if you have any questions, you feel free to call us at 215-608-1966. Thank you so much for your time and feel free to ask us any questions. Bye-bye.